Let's get to. I want to kind of get through everybody who's been holding the longest or whatever. Lawrence in St. Paul thinks the bill is a watered-down farce.
Yes, it is. I tell you what, and to think that this president has done a good job signing the stem cell bill, signing the bill so he won't stay on airplanes 3 hours, winning the Nobel Prize. Just to think, oh, wait a minute, he did do a good job.
Right, yeah, he did actually. It's actually, yeah.
But let me just, I know it's good. Let me just say something about, I kind of equivocate this Obama with Martin Luther King, for example. Mm-hmm. And I'm kind of glad Obama wasn't head of the civil rights movement, because I would think that we probably would have been able to only sit halfway up the bus.
Now.
Well, let me tell you this. The bill. How fast
did the change that Martin Luther King Jr. Advocate for happen? How fast?
Well, and that's where I have the problem. It was immediate. You had him sitting in the room signing President Johnson signing the bill by 1963.
Right, and how long was the civil rights marches going on? Years?
Well, actually, yeah, it started in 1955, and actually
there you go. So
that,
we're looking at 7 years time when for the civil rights struggle, and then after the bill was signed itself, how long after that before the country caught up to it?
Right.
Is it still there?
Yeah, I understand where you're going.
Right.
And what I'm trying to say is, I agree this bill is going to take a long time, but it actually would have taken a shorter time had Obama been a little more proactive in the initial onsets of the bill. For example, he should have came out and said, look, I'm either for or against a public option. He should have never said that is not a necessity. He should have said, I'm for it. And he should have rallied his troops around.
I think he's not necessarily for it. I think he's for making sure that 60 million people or the 40 million that were uninsured entirely or who are in danger, the 60 million that were in danger of constantly losing their insurance were covered. And however we managed to do that without it costing them, and bettering our own healthcare response, not only the electronic medical bill or medical records, all these elements that he brought up that were important to him, he came out directly for. But insofar as the public option, let's say, in many ways, there were people in the Congress, especially even in the Democratic caucus, who would dig their heels in against it, and you saw that actually happen in the Senate. Saw that it would actually, if he came out and said it has to be in there, and that's the way it's going to happen, this is the only way it's going to take off, the bill would have been dead on arrival. And I think what his goal was is to make incremental change that really lasts. And I honestly believe, and I'm not just saying this because I'm cheerleading, I really do believe that there are steps that need to be taken along the way. And the reason this hasn't happened so far is, A, because the Republicans would never have anything to do with helping it at all, ever. That we know this, that they have no interest in fixing this at all. And that the Democrats, the last time they did it was during Bill Clinton, and Bill Clinton did exactly what you're saying. He had his hands all over it. And so did Hillary. And what did they do? They stamped it with the label of Hillary Care, and they killed it on the floor. It never made it this far. We are actually this close to getting a bill passed that will cover 60 million new people, will guarantee Medicaid protection for people 150% above the poverty line.
Yeah, but you still have to buy into the private insurance companies if you're not.
Well, that's one of the other options. One of the things that they're not really talking about is in the Senate bill. There is a provision for the establishment of nonprofits in the same way that, technically speaking, the Fed is a non-government entity. It is a private corporation that is overseen by the government.
Right.
The public option would be a government-run insurance situation. What the Senate bill actually has in it is language that allows for this at a later date or during this entire process over the next 2 years for the government to establish private organizations that are overseen by the government in the same way that they could establish something like the Fed, that any state could participate in, and that you could participate in the national exchange. So in many ways, the public option is in there. It's just not specifically government run in that regard. So what they're doing is they're dovetailing around the main argument against it. And I think that's smart. Now, if they didn't do it, if they're doing what, like I said, if they did what you're saying, I think it would have been dead on arrival the same way Hillary Care was.
But I understand, and your argument is very compelling. But reconcile this statement here.
Okay.
Why? Okay, if we are required to buy into private insurance, but we have the option, they got to provide cost-effective insurance. Well, why didn't he push that as part of the bill instead of just being ambiguous about it? Do you think he was much of a leader?
No, I think he was. I think there's an element of, you go, I'm going to let the people's representatives state by state, so they can't come back to me later and say I shoved this through in any way. And there are elements of this bill that they have fought for all along. They've just done it largely behind closed doors. They have made the deals necessary. And I think David Bender made a great, compelling point, was that if we saw the backroom dealing that LBJ went through to get Medicare, LBJ would have made Obama look like Kennedy made Clinton look, as far as the ladies went, if you know what I mean.
Yeah,
there's an element of the only reason we're aware of it is because we live in a YouTube generation. We are now, everything is available, so we can look at this stuff. So here's what I think is important. I get what you're saying about the watered down element of it, but the truth is, one of the reasons why the Republicans are flipping out about this bill, and most of us on the progressive side, on the far progressive side, are going, why would you flip out? It's, there's not much, in it after minus the public option or whatever. It's because they know this is what they would consider a slippery slope. This is the foot in the door, and that the establishment of the possibility of nonprofits that are in here, that are, in many ways are corporations overseen by the government to protect consumers' rights, that can create insurance groups and co-ops and actual straight-up insurance, nonprofit insurance corporations that are overseen by the government, is a way of having the public option as it is without having to deal with passing that through and creating a new piece of legislation. And what you do is, now you have that as part of the reconciliation process, which is normal budgetary procedure, which means 51 votes handle it.
Hey, can I just say one thing here?
Sure.
Your argument is very compelling.
I know.
And you actually changed my mind. So is there any way you can get your argument out the way you just...
I'm on the radio and I'm on Ustream and I'm on Twitter all the time about it. I think the important thing is that we need to all pay attention more to the bills. And I think we need to know that this president has stated his objectives. You can go back and look online. Go to the White House website. Look at what he stated as his goals for this back in August. And see if they have not been met, and they have in a lot of ways, even in the Senate bill. And there's options in this for it to get even better. And the point is that we can't. This is an exercise program. This is not a pill. This is the problem with our healthcare system, and it's also the problem with the way we think. We're looking for some sort of magic dose. What is the Robitussin I can drink to make this cough go away? Instead of stop smoking, stop eating the crap I'm eating, realize that I'm allergic to dairy, and stop eating it just because I like pizza. It's a lifestyle change, and we are going through a lifestyle change right now. I appreciate your call. Thank you so much for letting me at least make my argument as cogent as I can.
Good point. I
Thank
agree.
you.
You've changed my mind.
Thank you, brother. Absolutely. We do need to focus on this. How much time do we have, Tony, before we get a break? We got to take a break. We could take one now, you think? Yeah, we'll do it. We're going to take a break right now because I want to have a little bit of time for calls in the bottom half of the hour. I tend to get squeezed in that last little bit. I'm Hal Sparks on Twitter. You can find me on Ustream, the the-hal-sparks-hot-sexy-cam-show. I'm filling in for Stephanie on the Stephanie Miller Show while they're away on vacation. 1-800-STEPH-12 is our number. More of your calls when we get back.